Chapter 24, Learning in Small Groups. The advantages of small group teaching outweigh the problems that can arise. Conducted appropriately, small group sessions can be successful, but be aware that the teacher's role should be one of facilitator. What is small group teaching? Small group teaching has been a feature of education programs for many years, particularly in the clinical context. With the introduction of problem-based learning and team-based learning, small group teaching attracted renewed interest. Learners work together in a group, interacting to achieve common learning goals. A tutor may facilitate the work of a group, or the group may be self-directed. Role of small group teaching. Small group teaching should be included in the teacher's toolkit. Students working in small groups can master learning outcomes not readily achievable using other learning methods. Learning outcomes achieved through small group teaching include the development of social and interpersonal skills and communication skills such as listening and debating. These skills have been recognized as important learning outcomes to be addressed in an educational program. The ability of a student to work as a member of a team and to recognize the roles of other team members. Students are encouraged in small group work to behave in a professional manner and to respect the views of others in the group. Doctors need to work effectively as team members, and the skills that enable them to do so should not be taken for granted. The ability for students to engage in problem solving, critical thinking, the analysis of a complex issue, and refining their understanding. The fostering of skills required by students to cope with uncertainty. This reflects medical practice, where issues are frequently complex and uncertainty not uncommon. Innovative thinking, creativity, and the development of new ideas. Deep learning with a more complete understanding of the subject rather than superficial learning where there is an emphasis on memorization. Students reflecting on their own abilities and attitudes and exploring further the concept of professionalism in medical practice. Members of the group may find preconceived beliefs challenged. Students' ability to take responsibility for their own learning. Advantages of small group teaching. Small group work offers a number of advantages. Small group learning addresses learning outcomes as described above that are less easily met by other teaching methods. Small group learning embraces the FAIR principles of effective learning as described in Chapter 3. In particular, it encourages active rather than passive learning and provides learners with immediate feedback with regard to their understanding of a subject. Students find working in properly organized small groups engaging and motivating and are encouraged to continue further with their learning. The approach does place demands on the students, but they find the less formal atmosphere of group work more relaxed and conducive to learning. The experience may even be enjoyable. Small group work draws and builds on the expertise and talents of the members of the group. The less effective and efficient learners may learn from others in the group and improve their learning skills. Studies have shown that where a number of groups have addressed a problem, the results from the poorest group are invariably better than the results from the best individual student working alone. Problems with small group teaching. Working with small groups can be problematic. Teachers may not use the method effectively and group sessions may be mismanaged. Teachers accustomed to lecturing may be less experienced in the role of facilitator in the small group setting. As a result, small group work deteriorates into mini lectures. Small group teaching is considerably more difficult to manage than a lecture as more attention needs to be paid to individual students' behavior, personalities, and difficulties. Diversity in a group promotes varied and interesting opinions, but it also has the potential to create conflict and may interfere with the proper functioning of the group. Scheduling the necessary number of rooms for small group teaching may present a logistical problem. If a class of 180 students has small group activities scheduled at the same time with 9 students in a group, 20 small group rooms need to be made available. This is not a problem in team-based learning as the small group activities take place in a lecture theatre or large demonstration room. Excessive demands may be placed on teachers' time requiring a higher than normal teacher-student ratio. This can be less of a problem if there is greater emphasis placed on student-directed groups, or if one teacher, as in the team-based learning approach, manages a number of small groups. Students too often are not briefed before a small group session about the benefits to be gained and the expected learning outcomes. As a result, they may not value what they learn in the small group work and may consider it to be a less effective use of their time compared with attending a lecture or reading a textbook. Techniques used in small group work. A number of approaches can be used to organize a small group session. Some will be more applicable than others depending on the situation, the learners, the local context, and the expected learning outcomes. Brainstorming. This is a creative thinking exercise in which group members generate as many ideas as possible without criticizing or questioning their validity until time or ideas are exhausted. The ideas are then discussed. This approach is especially valuable to encourage creativity and generate new ideas. Snowballing. Learners work initially in pairs to discuss the issue or task. They then join with another pair to compare and contrast their results. The group of 4 learners then combine with another group of 4 and the exercise is repeated. The deliberations are finally discussed in a plenary session. Snowballing particularly encourages clarification of ideas and values in a non-threatening situation. A variation of snowballing is the jigsaw group. With this technique, after a topic is discussed, the groups reform into new groups, with each new group containing one member of the old group. Role play. Students enact a scenario assuming in turn the role of the doctor, nurse, or patient. Role playing is particularly valuable in exploring communication issues and attitudes. The sessions may be videoed, and this can be helpful to students who can view and analyze their own performance and learn from it. Journal club. This approach is frequently used in postgraduate education. Participants are asked to present and comment on recent papers in the medical literature. The group then discuss the comments. Tutorial seminar. Tutorials are particularly helpful to enable students to critically probe subject matter in more detail. This helps them to clarify and expand on their understanding. Triggers such as clinical photographs, a video clip, or a short student presentation may be used as a springboard for the tutorial. In a tutorial, the group can discuss material that has been covered in a lecture or in a directed self-learning exercise. The tutorial may be focused on aspects of the subject where students have encountered difficulties. Problem-based learning. Small group work plays a key role in PBL as discussed in Chapter 16. Group discussions are directed around a problem presented to the group. The students' learning needs relating to the problem are identified. Clinical teaching. Teaching is conducted with a small number of students around patients in the ward or outpatient department. Clinical skills centers also provide the setting for clinical teaching, with small groups using simulated patients and models. Clinical teaching is discussed in more detail in Chapter 26. Turn-based learning. This is described later in the chapter. Implementing small group work. Facilitating a small group is one of the most skilled tasks the teacher can undertake. The teacher has to guide the work of the group without dominating it and encourage the learners to interact. There has been much discussion, particularly in the context of PBL, on whether the group facilitator should be a content expert or a person who has the facilitating skills without necessarily having content expertise. In most situations, content expertise is seen as an important prerequisite for the teacher. In small group work, content expertise on its own is insufficient. It is important that a teacher has an understanding of the small group process and the necessary facilitation skills. Some teachers are better than others at running small group sessions, and some medical schools or postgraduate institutions prefer to use as group facilitators only teachers who excel in this area. There should, however, be a staff development program in place to help teachers acquire the skills involved. Listed below are the tasks that should be undertaken before, during, and after a small group session if it is to be successful. Before a small group activity. A small group activity may appear relatively informal, but to be effective it has to be well planned. The teacher needs to decide which approach to adopt and what type of activities to include. For example, will there be an element of brainstorming or snowballing? Determine the composition and the number of students in the group. Group size can vary, but a generally accepted optimum number of students is 7 or 8. In some situations, this has to be expanded but should probably not exceed 12. Arrange the venue for the group meeting and the seating arrangements that will encourage discussion. Figure 24.1 shows three scenarios. The first is the preferred option and maximizes the interaction of the group. The second emphasizes the role of the teacher or group leader. The third replicates a lecture theater setting and should be avoided. Create the right learning environment. For example, noise from adjacent rooms can be a disaster. Specify the expected learning outcomes for the session. These will reflect both the subject matter or theme for the group session and also more generic competencies such as reflection and interpersonal skills. Ensure that you are familiar with how the small group session relates to the other learning opportunities available to the students. Plan the necessary resources, e.g., trigger material in the form of a short video clip, case study, or published paper. The trigger may involve real or simulated patients. Brief the students in advance if you expect them to do some preparatory work or gain practical experience in the area prior to the small group session. Figure 24.1 Seating plans for small group teaching. During a small group activity, there is no one best way of managing a small group and dealing with any problems as they arise. The following guidelines may be helpful. The group members should introduce themselves to each other and state their personal goals and expectations. This sets the scene for the work to be done and can serve as an icebreaker. Review the expected learning outcomes and how these will be achieved. Students may enter this small group activity with some reluctance, feeling the time spent is wasteful and that they will learn better in some other way. One of the common reasons for groups failing is the lack of clear goals and outcomes. Establish the ground rules for working as a group, recognizing that some people may feel threatened in the group situation. Rules should ensure that contributions are received positively. Typical rules might be that only one member talks at any one time and that all members contribute. Create a positive atmosphere for the students' learning. There has to be an atmosphere of mutual trust and respect, and students should feel comfortable enough to expose their areas of weakness. Focus the group on the task in hand. How this is done will depend on the agreed learning outcomes and group methods adopted. Keep the learning process moving. Encourage participation from members of the group by using open-ended questions, listening to what is being said and responding. Monitor the progress of each student in the group. Avoid being the center or focus of the small group activity, and do not provide information that other members of the group can provide or that they can get elsewhere. Keep the discussion at the appropriate level. It should not be boring or over-challenging. Recognize the different roles group members play. For example, information provider or influencer, and use this information to help the group accomplish the task. Tackle problems in the group, such as a dominant, careless, or lazy learner, by calling time out and asking the group how they want to solve the issue. Towards the end of the session, summarize what has been achieved and plan what is expected of the group before they next meet. After a small group session, teachers need to support any follow-up actions identified at the group meeting. These may include access to further learning opportunities or communication online between group members. Plan any further small group sessions if required. Complete any student attendance sheets or student evaluation required. Evaluate the small group session, for example, through student feedback forms. Reflect on the experience gained by the students and yourself, and consider how the small group session might be improved if it has to be repeated. Theme-based learning. What is TBL? Theme-based learning is an approach to small group work that has been adopted in a number of medical schools and has been shown to provide a positive learning experience for students. Theme-based learning is an active learning and small group instructional strategy that provides students with opportunities to apply conceptual knowledge through a sequence of activities that includes individual work, teamwork, and immediate feedback. TBL can be used with large groups of students divided into multiple small groups directed by one teacher. Implementation of TBL. TBL involves the following stages. 1. Students' preparatory work prior to the session includes readings, videos, lectures, and other learning activities. 2. At the start of the session, students are assessed individually using a set of MCQs, the Individual Readiness Assurance Test. 3. The students are divided into teams in the classroom or lecture theater and, following a discussion, answer the same IRAT questions. They receive immediate feedback on the team answers the Team Readiness Assurance Test. 4. The teacher clarifies the concepts relating to questions where students had difficulties. 5. Students working in the same team are presented with a practical scenario or problem to which they have to provide answers. The teams display their answers simultaneously to the whole class and the teacher and justify their responses. Team application. 6. The teacher facilitates discussion about the answers and a team can challenge an answer designated to be best. The appeal. TBL has been compared to PBL. Each approach has strong points. Like PBL, TBL involves learning around professionally relevant problems with students learning in small groups or teams. Feedback is given by students and the teacher. A major difference is that in TBL, one teacher is responsible for all of the student groups who work simultaneously in one location. This can be in a lecture theater or accommodation designed for this purpose. In TBL, unlike PBL, students have a mandatory pre-class assignment.